Medicare, the fix those are to bend the cost curve, make health care more efficient. The other alternative, which is often one that is presented by Republican colleagues, is to essentially voucherize the system. I mean, that's been the main proposal that they've got that was presented during this debate in terms of saving Medicare. And what that basically means is, you know what, we're going to give you a set amount. Let's just hypothetically, we'll give you $5,000. You buy your own health insurance on the private market instead of getting Medicare. But think about it. What happens, you $5,000 and it turns out the costs are $10. It comes out of your pocket. And then the next year, the costs are $12,000, and maybe they gave you an adjustment on adjustments. So now you get $5,500. The cost for the same quality care you're getting under Medicaid is $12,000. I mean, there's an easy way to make it look like you're solving the problem. You just dump it on other people. And what we're trying to do is actually solve the problem by making the healthcare system more efficient. It's going to be harder, fairer, more just. It's going to keep the commitment and the promise of Medicare for years to come.
Thank you, Mr. President. Operator, we have time for one more from the out there.
Next question comes from Dennis Yurka from Las Vegas, Nevada. Dennis, please go ahead and ask your question.
Mr. President.
Hi, Dennis. Good.
I am a retiree who's a member of the International Union of Painters and Allied Trades who is currently drawing my health insurance from COBRA. Since the federal subsidy from my employer is in danger of being discontinued, and I have confirmed my former employer will not offer COBRA if the subsidy is discontinued, what am I supposed to do, and how does the new health care law help me now to get health care, especially since my wife is dealing with some very serious health issues?
Dennis, can I just ask you, so you don't yet qualify for Medicare. You're COBRA because your employer is not, you're not on the job right now. Is that what's going on?
Correct.
Okay. Well, here's what happened. Is because of just this terrible recession that we had, we knew that a lot of folks were going to be losing their jobs. I mean, when I took office, 750,000 per month were losing their jobs. Now, because of the Recovery Act, the great work that Congress did, we're now gaining jobs again every month. But we had that 8 million hole that was created because of the recession, and that's going to take some time to fill. So you've got a lot of people like Dennis out there, people in the trades, folks who were laid off, who not only are struggling to pay their bills, they were in danger of losing their health care because they got it through the job. There's been a program around for a long time called COBRA. Some of you know about it. The idea is that you're, by law, allowed to keep your health insurance if you lose your job just by paying the premiums. So the premiums are $1,000 a month. You're paying those. Now you've lost your job, so you've got even less money. A lot of people couldn't afford COBRA. So one of the most important things we did in the Recovery Act, and a lot of people realize this, but this was hugely important to so many Americans, including Dennis, as you just heard. The Recovery Act, we said we are going to subsidize 65% of the costs of what premiums were, so that you can keep your health insurance even as you're looking for a job trying to get back on your feet. If your premium for your family was $1,000 a month, now it only costs you $350 a month. We have sustained that for a year and a half now, and we think it's important to sustain it for at least another 6 months because a lot of folks who are out of work. The economy is improving. The unemployment rate is still high. Being debated right now. And so, Dennis, the answer is to make sure that Congress, through on its commitment, ahead and maintain COBRA until people are working at a higher rate again. Now, that's not a long-term solution to Dennis's question, though. The problem is that for a lot of folks like Dennis, once COBRA ran out, before this crisis and before the Recovery Act, you're out of luck. You didn't have a job, you didn't have health insurance, because buying health insurance in the private marketplace as an individual is prohibitively expensive. If you're not part of a big pool, can negotiate with the insurance companies, they jack up your rates. So you're paying 20% more or 30% more than you'd be paying if you were working for a big company. In some cases, if you've got a pre-existing condition, you just can't get health insurance at all. I've been through this. Some of you, if you haven't yet qualified for Medicare, are going through it right now. There are a lot of early retirees who yet qualified for Medicare, but lost their job. They've got enough savings to support them, but don't have enough savings to be paying these huge medical bills. So the whole idea behind the health reform bill, let's put you in a pool so you get the same leverage that somebody else does. Even if you're on your own or you're a small business owner, we'll give you the same negotiating power that somebody who works at Google has. Or another example, you're a federal worker, you're a pool, and you get a great deal. So the way the health care bill is structured is this. Somebody like Dennis, even after COBRA is, he's no longer eligible for COBRA. Somebody like Dennis sign up to be part of a pool where they got the best, lowest rates possible. Kathleen Sebelius, the Secretary of Health and Human Services, would be overseeing what policies were that were offered. Choice of plans. It can be, one size fits all. If Dennis had a bigger family and he mentioned his wife, so he wanted to have a certain kind of better insurance, he could pay a little bit more. Was young and single and feeling healthy, he could have a cheaper version. The point is, he'd get the benefit of being part of this big pool. The main concept behind this health care reform bill. If you still couldn't afford it, and there's some people who, if they're making minimum wage, they're not making a lot of money, still couldn't afford the premium, even though it's a much better deal than what could get on their own, provide tax credits, provide subsidies to help people pay for their insurance. All of this doesn't go into effect in 2013, and I'll anticipate the question earlier. How come it's taken so long? In this case, it's not just a question of money, it's also a question of just setting it up right. We're talking about 30 million people suddenly getting insurance. That you've got to set it up in a way that is efficient, isn't subject to fraud. We had to phase that in to do it right over a certain number of years. But the key is by 2014, which is right around the corner, you're going to see is a situation where somebody like Dennis, his COBRA eligibility has lapsed. He's going to know, have confidence, have the security that he can look after himself and his wife when it comes to their health care needs. And that is something that has existed in every other industrialized country in the world, the United States, until this year. About that. The wealthiest nation on earth, country, had that basic security except us. And what we did was we didn't do anything radical. We didn't, contrary to our critics, this isn't socialized medicine. We built off the private system that we already had, but we said, you know what, to fill these gaps so that everybody has security. You have no parent out there who's thinking, I'm not sure I can afford to take my child even